Welcome back. On today's video we're talking all about meniscal tears. It's a very common injury, and first you need to know if you've got one, and the way to know that is squat, and if your knee is popping as you come up and you're getting pain, then something's potentially catching. And there's two things it could be. One, it could be the patella, which is the bone at the front of your knee, flicking over because there's a muscle imbalance, and if you've got that, that's probably been there for a long time, and you'd know that it's that because it's been getting progressively worse over time. If, as opposed to that, you have a sudden onset of a clicking or popping and pain that starts in your knee, then that's more likely to be meniscus. One, it can have from degenerative stuff. I've had a guy who come to see me who was at a urinal and he was peeing and he turned around and popped his knee and it was his meniscus and he had to get surgical repair of it. The other consideration apart from degeneration of meniscal tears is acute trauma. So you could have somebody with their leg planted and they get some pressure, or someone sitting cross-legged for a long period of time and they straighten out their leg and they feel a pop. Those are some of the potentials for what could be causing it. So it's either patella tracking type stuff if you're getting a popping and pain, or it's going to be meniscus, and in most cases it's one of the two of these. And let's look at what a meniscus is. So I've got my beautiful assistant here, this chart, and if we look at the bottom here, you can see that you've got these cushions in between the knee. You've got your big bone of your femur, densest, heaviest, strongest bone in the body, and then you've got your tibia. So you've got your bone, your thigh bone, and then your leg bone. Anatomically, that's what we call it, but that's generally people call that all the leg. And then you've got these cushions in between it, and they are shock absorbing discs, and through wear and tear or through trauma you can actually crack one of those, and as it tears or cracks it can come up, and then when you bend the knee, then you tend to get, like, if you imagine that's my knee, when you bend the knee the capsule gets, and the cartilage gets caught in the middle, and then you get pain and popping. And the test for that is called Apley's test, which I'll link to in the description box, so you can test yourself and see if you've got it. I've got a video on how to know if you've got a meniscus tear. But if you've got this type of thing, and that's just one mechanism of how you can get it. You've got that picture there with the American footballer running into the other American footballer. If you've got this type of thing, does it get better on its own? Some cases do get better on their own. So the analogy is often used of having a stone in your shoe. The stone in your shoe doesn't go away, but it can be moved in a position where it doesn't bother you, and then you can rehab the knee, get the knee so strong that there's not so much pressure on the joint, and you can be fine for 10, 15, however many years. So I have a lot of patients who do that. They rehab it and they're fine, and they don't need to have any further intervention if they don't have any knee problems. And they might be a bit careful on a couple of things when they're really putting a lot of pressure on the knee, if they're grapplers for example, but otherwise they're perfectly fine. And I have the other people who go down the surgical route and their surgery fails. They come out of the surgery and they still have the problem once the initial swelling is down, or a couple of months down the line, as soon as they get back into sports, they get the same problem again. So in my experience, with the thousands of people that I've seen, there's no guarantee of having surgery is going to fix the problem. So you are, in most cases, better off doing unless you have a very severe meniscus tear, which is really impacting on your quality of life, then I would recommend doing the rehabilitation first, seeing how much relief you can get, and then taking it from there. In terms of rehabilitation, it's going to be a lot of quad work, a lot of core stability work, so things like leg extensions, leg raises, glute raises, or the bridge. Other things would be hyperextensions, planks, side planks, sit-ups, toes to bar on a pull-up bar, all of these types of exercises which I've done loads of videos on, and you can have a look in my playlist for my videos on training and how to rehabilitate these areas. So hopefully that helps clear up what is a knee meniscus tear, and how can you fix it, what are your options. And your options are pretty much either surgery or rehab, and I would recommend most people go down the rehab route, but do consult your doctor and find out what they say and get their opinion before you start any regime, whatever that may be. In terms of nutritionally, there are things that you can do for inflammation. Turmeric's known to improve inflammation, and that's taking it dietarily. There's other things like chondroitin and MSM, which is meant to be good for joint health, and potentially you could take that, although there's much more research. There's some positive research to show that it helps in hip pain, but not so much in knees. But I mean, you could take it. What's the harm in trying it for a month and seeing if it helps? So those are two options there. Make sure you keep your water intake really high, because that's going to help with inflammation in the body. And if there's any aggravating positions like sitting cross-legged or running, then try to avoid those positions while you rehabilitate the knee. Once you get strong enough, the resilience will build, and then you'll be able to do those over time. So I hope that helps. Please leave me a comment in the comment box below, and I'll catch you in the next video.